South Bay Health and Insurance Services clears away the confusion by serving as a resource and advocate for all of your continued healthcare needs. Joining me now to talk about Medicare assistance and how you can finally pick the right plan for you is South Bay Health and Insurance Services President Patricia Salas. Welcome, Patricia.
Thank you so much.
So tell us, what is South Bay Health and Insurance Services? Tell us about that.
We're also known as SBS. What we are is we're an insurance agency that helps people with Medicare or Medicare and Medi-Cal find the plan that best suits their needs. All of our services are free of charge, and many people see us as a navigator, someone who assists the person who has the need and is confused because of all the options in front of them, find the right plan that suits whatever it is that they need covered.
Well, and plus Medicare plans change every year practically, right?
They change on an annual basis, the costs change, what they cover changes, but what's most important to the seniors, particularly in our economy, is what the fees are. You know, did the copay levels go higher? Is there now a percentage that I'm responsible or not? And if they have something like a Medicare supplement or Medigap policies, did my policy go up in price?
So what is the low-income subsidy, and who would qualify for something like that?
Many of our seniors qualify. So just to clarify, Medicare is something that you're entitled to because you worked or your spouse did, right? So that's a federal benefit. Medi-Cal is state assistance, and that's based on your income, and it tends to be the lower income people that have that, and something that you qualify for, you apply. In the middle, we have seniors who are barely making it month to month. Yet they're not poor enough to qualify for Medi-Cal, but the cost of prescriptions is extremely expensive. So they're those in-betweeners. Yeah. They would qualify for low-income subsidy. It's a federal program that everyone's entitled to. It's not like Medi-Cal where they could put a lien on your property or something like that. In this case, if the income for a single person is below $1,396, or below $1,800 for a married couple, then they can qualify. What it can do is it can reduce the cost of their medications to $2.65 for generics and $6.60 for brand. So just to give you an example, we had a client yesterday that was on a brand medication. They had an HMO with their Medicare. They had a brand name prescription that was not a preferred prescription. So the copay for it was $95. Okay, $95. We qualified them for LIS, and they dropped to $660.
That's amazing. Now, where are you located?
Our office is at 2424 Arden Way.
Perfect.
In Sacramento. And we've been there for the past 6 months, I believe. So, you know, we have grown very much, and we're there to assist anyone that has Medicare, is about to become Medicare eligible, and needs assistance.
And tell us about the services. What exactly are the services?
So what we do is we help you apply for your Medicare if you haven't done it. That's called your new benefits application for Social Security. We'll do that. If you need to choose a plan because you already have Medicare, we can help you with that. If you have Medicare and Medi-Cal, we can help you find a plan that fits your needs. If you're someone who doesn't want an HMO product but wants a Medicare supplement because you like the freedom and you're willing to pay more out of pocket, we'll help you find a Medicare supplement that makes sense for you. And lately we've been working with a lot of employer groups that have seniors who are working with them that are reaching the age of 65 and are looking for other options because they're making that group policy too expensive. So we're helping them come in, we're relieving the weight on the company, and we're making sure that the employee has better coverage than they did before at a lower cost.
And I would assume you're talking about folks, but also caregivers would be interested in
caregivers,
like this,
family members. In many instances, many of our members have children, have nieces, nephews, someone who's assisting them understand, because it's confusing. It's a lot of information that comes to the home, and it's a lot to take in. So, you know, our job is to make it simple, simplify the whole thing. We like to say one call does it all. So call the number that's on the screen. Our number is 1-888-988-8682. And really it does it all.
And check out the website if you get a sec too. There's some great information on
For sure.
I checked it out before we got here. It's great. Well, thank you, Patricia, for being here.
Pleasure.
Good information.